CLEAR is a really important phase 3 trial in the first-line treatment of metastatic renal cell carcinoma. It is one of the last trials that randomized patients to Sunitinib as a control cohort. And so every patient that was enrolled on the study had advanced clear cell renal cell carcinoma that was treatment naive. And they were randomized to one of 3 cohorts, either Lenvatinib with Pembrolizumab, with the Lenvatinib starting dose at 20 milligrams daily, Lenvatinib with Everolimus, which is our standard combination given a refractory renal cell carcinoma, or Sunitinib at the standard dosing of 50 milligrams, 4 weeks on, 2 weeks off. A final 1,069 patients were randomized, so a bit more than 350 per cohort. And the trial was very positive for improved progression-free survival with a hazard ratio of 0.39 comparing Lenvatinib Pembrolizumab to Sunitinib, as well as improved overall survival with a hazard ratio there of 0.66 compared with Sunitinib. And then finally, we saw pretty impressive objective response rates, 71% for Lenvatinib with Pembrolizumab, including 16% complete responders. And that probably is the highest CR rate we've seen with these VEGF and immunotherapy combinations. So CLEAR certainly adds a great deal as a new treatment option for patients with metastatic clear cell kidney cancer in the frontline setting. We did see significant toxicities that some that are significant to the VEGF inhibitor, like hypertension and stomatitis, hand-foot syndrome, but some that are also overlapping with the immunotherapy component, including the diarrhea, as well as hypothyroidism and fatigue. And overall, it seemed that patients were able to tolerate the combination of Lenvatinib and Pembrolizumab, and we will see this being used probably more and more in the frontline setting for these patients. So from the framework of the CLEAR trial, we also have designed an immunotherapy-based trial in the Alliance Cooperative Group. And so the PDIGREE trial is based on the premise of CheckMate 214 for Ipilimumab, Nivolumab combination. And then really also dependent on the activity of Cabozantinib and Nivolumab combination seen in the CheckMate 9ER study that was presented at ESMO in 2020. But based on both of those studies, PDIGREE is fully open and accruing across all NCTN study centers. And this is an adaptive trial of Ipilimumab, Nivolumab upfront for all patients with metastatic renal cell carcinoma with intermediate and poor risk disease. Everyone gets up to 4 cycles of the Ipi-Nivo combination. And then at the 3-month time point, treatment is adapted for responses. So complete responders receive Nivolumab alone. Patients with progressive disease receive Cabozantinib alone, and patients who basically are stable or have partial response are randomized to receiving either Nivolumab or Nivolumab with Cabozantinib. And so our primary endpoint is to improve the overall survival of the randomized cohort. And we're a bit more than 300 patients enrolled out of about 700 needed to randomize, and accounting for dropouts from the adaptive design, we'll need up to about 1,000 patients enrolled overall. But enrollment is going along very well, and we're hoping to continue to enroll well across all NCTN centers, and appreciate certainly all of our patients who are participating in this study as we move forward. I would expect potentially data coming out of this trial in the next 3 to 4 years.